Foreign bodies of the bladder. Foreign bodies may enter the bladder down the ureter, through the wall of the bladder, or up the urethra. Ureteral. Crystals, stones, blood clots, shreds of tissue descend the ureter and may be caught in the bladder. Parietal. Apart from the substances which may be introduced through wounds, there are two types of parietal foreign bodies. One consists of the gauze sponges, etc., that may be left in the bladder at the time of operation, and the silk sutures with which the bladder may be tied and which work their way into that organ. The second class of parietal foreign bodies reach the bladder through the bursting and emptying of the abscess containing them into the bladder. Of such objects as pins may, of their own impetus, migrate into the bladder without suppuration. Urethral. Foreign bodies are introduced into the bladder through the urethra by the insane and the pervert. This practice is much more common in certain European countries than in the United States. These foreign bodies are much more likely to slip through the short urethra of a woman than that of the man. Consequently, they are much more commonly found in women's bladders. The substances usually employed are chewing gum, hairpins, and hat pins. In this manner, every substance that the urethra will admit has at one time or another been introduced into it and been found in the bladder subsequently. It were a waste of time, therefore, to attempt any specific enumeration. The curious may refer to the exhaustive monograph of English. A generation ago, it was not uncommon for catheters to break off inside the bladder. Improvement in their manufacture makes this accident most uncommon nowadays, but our intravesical operative instruments sometimes break and are thus lost. Blood clots and bits of sloughing tissue left in the bladder after operation form the nuclei of post-prostatectomy calculi. Results. The foreign body may remain silent in the bladder for a considerable length of time, especially if it be small, rounded, or soft. But sooner or later, staphylococcus or streptococcus infection occurs, phosphatic incrustation ensues, and a phosphatic stone develops around the foreign body as a nucleus. Figure 85. Figure 85, stone on twig, natural size. The symptoms thereafter are those of stone. Such stones are usually best attacked by cystotomy, though gum, pins, etc. may be extracted by means of the cystoscopic forceps. Pilimiction. The one special type of vesical foreign body which has received distinguished mention in the past is best known under the title of pilimiction, the urination of hair. My father had one such case, an insane patient who introduced the hair into his bladder through the urethra. But it may be set down as an almost universal rule if the patient urinates hair or stone formed upon hair, figure 86, that this comes from a dermoid cyst which has ruptured into the bladder. Heller has collected 57 cases of this condition. I have seen one case which was readily identified by cystoscopy. The treatment required is excision of the dermoid cyst. Figure 86, stones formed on hairs of a dermoid cyst ruptured into the bladder, natural size.